If you are over 60, please listen carefully. What looks like dementia is not always dementia. Sometimes it is a medication. Sometimes it is two medications. And sometimes it is the combination of several pills that were each prescribed for a good reason, but together are making the brain slower, foggier, and more confused. A senior starts forgetting names. They repeat the same question. They feel dizzy in the morning. They lose focus during conversations. They walk into a room and forget why they came in. And the family begins to worry. Is this dementia? Is this Alzheimer's? Is this just aging? But before you accept that answer, there's one question every senior should ask. Could my medications be doing this? Because after 60, the brain becomes more sensitive. The liver may process drugs more slowly. The kidneys may clear drugs more slowly. And a pill that felt harmless at 45 can affect you very differently at 70. Today, I'm going to show you 7 common medication categories that can sometimes cause memory problems, brain fog, confusion, or dementia-like symptoms in older adults. I am not telling you to stop your medication. Please do not do that. Some of these medications are important. Some may be necessary. Some may even be life-saving. But if your thinking changed after starting a new medication, increasing a dose, or adding another pill, you deserve to ask questions. Knowledge is not dangerous. Silence is. Stay with me to number 1, because number 1 is not one single medication. It is the hidden pattern that affects millions of seniors, and it may be the most important part of this entire video. Let's begin. Number 7, diphenhydramine. Many people know this as Benadryl, but it also hides inside many sleep aids, allergy pills, cold medicines, and products labeled PM. That word matters. PM. Pain relief, nighttime cold medicine, sleep formula, nighttime allergy relief. Many of these products contain diphenhydramine or a similar older antihistamine. And because you can buy it without a prescription, many seniors assume it is harmless. But in an older brain, this medication can be a problem. Diphenhydramine belongs to a group of drugs called anticholinergics. That means it blocks acetylcholine. Acetylcholine is one of the brain chemicals involved in memory, focus, and alertness. When you block it, the brain can become slower. You may feel sleepy. You may feel foggy. You may feel confused. You may forget things more easily. You may also notice dry mouth, constipation, blurry vision, or dizziness. And for seniors, dizziness is not a small side effect. Dizziness can lead to falls. Falls can lead to broken bones. And a broken bone after 60 can change everything. Here is the part that worries me. A person may take diphenhydramine every night for sleep. Then they wake up groggy. Their memory feels worse. They feel unsteady. Their family says, "You seem more forgetful lately." But nobody checks the sleep aid. Nobody checks the allergy pill. Nobody checks the PM bottle on the nightstand. So if you are over 60, look at every over-the-counter medication you take, especially anything for sleep, allergies, or nighttime symptoms. Ask your doctor or pharmacist this exact question. Does this contain diphenhydramine or another anticholinergic? Then ask, is there a safer option for someone my age? That one question can save you months of confusion. Number 6, bladder control medications. This one affects many older adults and almost nobody wants to talk about it. Overactive bladder is real. Urgency is real. Waking up 3 or 4 times at night is exhausting, and bladder leakage can be embarrassing. So when a doctor gives a pill that helps, most people are relieved. But some bladder medications can affect the brain, especially older medications like oxybutynin. These drugs can calm the bladder by blocking signals, but some of them also have strong anticholinergic effects. That means they may block the same memory-related brain chemical we just talked about, acetylcholine. So the bladder may become calmer, but the brain may become foggier. A senior may start saying things like, "I can't find my words. I feel slower. I'm forgetting appointments. I feel sleepy during the day. I'm not as sharp as I used to be." And nobody connects it to the bladder medication. That is the problem. The medication gets blamed on age. The memory problem gets blamed on age. The confusion gets blamed on age. But sometimes the timeline tells the truth. If memory problems began after starting a bladder pill, increasing the dose, or taking it more regularly, it is worth reviewing. Do not stop it on your own. But do ask, is this medication anticholinergic? Could it affect memory or balance? Are there safer alternatives for older adults? Could bladder training, pelvic floor therapy, fluid timing, or a different medication help? This is not about suffering through bladder problems. It is about treating the bladder without sacrificing the brain. Number 5. Benzodiazepines and strong sleeping pills. This includes medications used for anxiety, panic, muscle relaxation, or sleep. Some common examples include alprazolam, lorazepam, diazepam, clonazepam, and temazepam. Many seniors were started on these medications years ago, maybe during grief, maybe during a stressful season, maybe after a panic attack, maybe after months of insomnia. And at first, the medication may have helped. It may have felt like a lifeline. So I want to be careful here. I am not judging anyone who takes these medications, but after 60, the risks become much more serious. These medications can slow the brain. They can affect memory. They can reduce alertness. They can increase confusion. They can affect balance. They can increase the risk of falls. And if taken at night, they can still affect the brain the next morning. A senior may think they are waking up rested, but the brain may still be under the effect of the medication. This can look like early dementia. Slow thinking, poor memory, repeating questions, trouble concentrating, more falls, less energy. But here is the most important warning. Never stop benzodiazepines suddenly. Stopping too fast can be dangerous. It can cause severe anxiety, shaking, insomnia, blood pressure changes, and in some cases, seizures. So if you are over 60 and taking one of these medications regularly, do not panic, do not throw it away, do not quit overnight. Instead, ask your doctor, is this still the safest option for me? Could this be affecting my memory, balance, or alertness? If we ever reduce it, what would a slow and safe taper look like? That word matters. Taper, slow, supervised, medical guidance. For sleep, there may be safer approaches. Sleep schedule changes, morning sunlight, treating pain, treating sleep apnea, reducing evening alcohol, cognitive behavioral therapy for insomnia. But the first step is the conversation. Number 4, amitriptyline and older tricyclic medications. This one surprises people. Because many seniors are not taking amitriptyline for depression, they may be taking it for nerve pain, migraines, fibromyalgia, sleep, chronic pain, or headaches. So when they hear that it is an older antidepressant, they are surprised. But the reason it matters is not the label. The reason it matters is how it affects the brain. Amitriptyline has strong anticholinergic effects. Again, that means it can interfere with acetylcholine, the memory and focus chemical. In younger people, this may show up as drowsiness. In older adults, it can show up as much more. Brain fog, dry mouth, constipation, blurred vision, urination problems, dizziness, daytime sleepiness, memory problems, and sometimes confusion. This is where families get misled. They may say, Dad is getting older, Mom is slowing down, Grandma is not herself. But nobody asks, what medication was added? What dose was changed? What pain pill is being used for sleep? If you are taking amitriptyline, especially at night, and you have noticed memory changes or daytime fog, ask your doctor, is this medication anticholinergic? Is it still the best choice for me at my age? Are there safer options for nerve pain, migraines, mood, or sleep? Could we review the dose? Again, do not stop suddenly without guidance, but do not ignore it. A medication that helps pain should not quietly steal clarity. Number 3, paroxetine, also known as Paxil. This one does not get enough attention. Paroxetine is an antidepressant in the SSRI family. Many people hear SSRI and think modern, safer, gentler, and many SSRIs can be useful for older adults. But paroxetine is different. Compared with many other SSRIs, paroxetine has more anticholinergic activity. That means it can be more likely to cause problems like dry mouth, constipation, sleepiness, dizziness, and cognitive fog in some older adults. It can also be harder to stop than some other antidepressants. If the dose is reduced too quickly, withdrawal symptoms can be uncomfortable. So again, do not stop it suddenly. But if you are over 60 and taking paroxetine, it deserves a review, especially if you have noticed more forgetfulness, more fatigue, more confusion, more falls, more trouble finding words, or a general feeling that your brain is not as clear as it used to be. Ask your doctor, is paroxetine still the best antidepressant for me at my age? Could it be affecting my memory or alertness? If we ever switch, how would we do it safely? There may be other options that are better tolerated in older adults, but that decision must be personal. Your history matters, your symptoms matter, your previous reactions matter. The goal is not to fear the medication. The goal is to make sure it still fits your brain today. Number 2. Antipsychotic medications used for sleep, agitation, or behavior. This one is serious. Antipsychotic medications can be necessary for certain conditions. They may be used for schizophrenia, bipolar disorder, severe agitation, hallucinations, or dangerous behavior. Sometimes they are needed, but in older adults, especially in hospitals, nursing homes, or memory care settings, these medications can sometimes be used too casually. A senior becomes restless. A senior calls out at night. A senior is confused after surgery. A senior is difficult to manage. And a medication is started, then weeks pass, then months pass, and nobody asks if it is still needed. These medications can cause heavy sedation, slowed thinking, less motivation, worse balance, more falls, and sometimes more confusion. A family may say, he is calmer now. She is not causing problems now. But calmer is not always better if the person is also less alert, less mobile, and less themselves. If your loved one is taking an antipsychotic, ask direct questions. What exact symptom is this treating? Is this for a diagnosed psychiatric condition or for behavior? What side effects should we watch for? When will this medication be reviewed? Is there a plan to reduce it if things improve? Have non-medication approaches been tried? These are fair questions. You are not being difficult. You are protecting someone's brain. And if you are the patient, you have the right to understand why a powerful medication is being used. Number 1, medication stacking. This is the biggest one, and it is the one most people miss. Sometimes one medication is not the problem. The stack is the problem. A senior takes one pill for sleep, one for bladder, one for allergies, one for pain, one for mood, one for reflux, one for blood pressure, one for cholesterol, maybe a supplement, maybe a nighttime cold medicine, maybe an occasional pain reliever. Each one may have a reason. Each one may have been prescribed by a different doctor, but the brain does not care which doctor prescribed it. The brain feels the total effect. This is called polypharmacy, and after 60, polypharmacy can quietly create confusion, dizziness, fatigue, falls, and memory problems, especially when several medications affect the brain in similar ways. The biggest danger is that nobody sees the full picture. The cardiologist sees the heart pills. The urologist sees the bladder pill. The psychiatrist sees the mood medication. The primary doctor sees part of the list. The patient adds a sleep aid from the pharmacy, and the family adds supplements. Now the senior is taking 8 or 10 things, and no one has stepped back to ask, what is the total brain burden? This is why every older adult should do a medication review, not once in a lifetime, regularly, at least once a year. And anytime memory changes suddenly, here is what to do. Put every medication in one bag: prescription pills, over-the-counter pills, sleep aids, allergy pills, pain relievers, supplements, vitamins, eye drops, creams, everything. Bring it to your doctor or pharmacist and say, I want to review my medication list for memory, balance, and alertness. Then ask these 5 questions. Question 1. Can any of these affect memory or thinking? Question 2. Can any of these increase fall risk? Question 3. Do I still need every medication here? Question 4. Are any of these risky together? Question 5. If we reduce anything, what is the safest way to do it? That last question matters. Safest way. Not fastest way, not stopping everything, not guessing. One step at a time, with guidance. Because the goal is not to throw away medication. The goal is to make the list smarter. Now, I want you to remember this. Memory loss after 60 should always be taken seriously, but it should not automatically be called dementia before medications are reviewed, especially if the change was sudden. True dementia often develops gradually, but sudden confusion can come from many things: medication side effects, medication interactions, dehydration, infection, poor sleep, low oxygen, blood sugar changes, pain, alcohol, or a recent hospital visit. So when memory changes, ask, what changed? Was there a new medication, a higher dose, a new sleep aid, a new bladder pill, a new pain medicine, a new antidepressant, a new pharmacy product? That timeline may reveal the truth. And sometimes, when the medication burden is reviewed carefully, the fog begins to lift. Not always, but sometimes. And that possibility is too important to ignore. So here is your action step. This week, write down everything you take, not just prescriptions, everything. Then schedule a medication review with your doctor or pharmacist. Use those exact words, medication review. And if you are worried about memory, say that clearly. Say, I want to know if any of my medications could be affecting my memory, balance, or alertness. That is a reasonable request. A good clinician should take it seriously. Before we finish, I want to say this one more time. Do not stop medication on your own. Do not change a dose on your own. Do not panic because you heard a medication name in this video. Use this video as a conversation starter, not as a treatment plan. Your body is unique. Your risks are unique. Your medication history is unique. But your brain is worth protecting, and sometimes protecting it starts with asking better questions. If this video helped you, subscribe to Dr. Robert Senior Health for simple, practical health guidance for older adults. And share this with someone over 60 who takes several medications. It may help them ask the question nobody has asked yet. Could my medicine cabinet be affecting my memory? Stay healthy, stay informed, and God bless. This video is for educational purposes only and does not replace medical advice. Always speak with your own doctor or pharmacist before changing any medication, supplement, or treatment.